My name is Michael Thomas Robinson, DO, family practitioner, now work for Tanner Primary Care in Roanoke. I went into medicine because the town I grew up in, the small town doc, was such a great guy. I was friends with his sons. Everybody liked him and respected him. He helped people, he was kind-hearted. He's still alive, but I never thought I could be a doctor, but I found out I could make grades and did well in college and went right on in, and it's been a great, great living. Love what I do. Why did I choose my specialty? I didn't really. I always loved emergency room. It happens fast, you help people real quick, stitch them up, car wrecks, it was exciting. I did that about 10 years alone in a rural town here in Wedowee. No backup, had no surgeons, we're sending them out by choppers. It was all real exciting, but it got after 10 years, and I spent a little time overseas in the war when everybody was so young, and I got my fill of calling in helicopters, and I got back from the war, and I just wanted to see people and help people, and I didn't want the life and death every second. And so it was a perfect setup for clinic, straight urgent care clinic, so now I do strictly urgent care. What do patients appreciate most about me? I don't know. You hear some of the kindest comments. People say I'm kind, I care. I feel like I'm too truthful. I'm real quick to say if you smoke, you shouldn't. I feel like I have to make rules all the time to people, but they seem to respond to it. I mean well. I absolutely mean well. Maybe that's the reason. Everything I do, I mean well. I think people notice that. You can say something really harsh to me, and if I believe you mean well for me, I'm not offended. What do I hope patients take from office visit? I hope they know somebody cares, not just about their health and their lab work's on time and everything's done every year, but I care about where they end up at, what kind of life they lead, so they understand what today's date stands for again and why they're here, what's really important. I don't want to be a cliche. I don't want any of my patients ever to die of prostate cancer or die of a heart attack because they didn't get a simple stress test. That's just such a waste to me. I can't stand that. Everybody needs certain things done every year. There's just no reason to die of a heart attack, for no reason. You can catch it early with a stress test. It's a simple thing. A mammogram, I don't want to go, but wow, you live a full life, you catch it early. Tanner's a first-rate company, and as much as I like to talk about people, you have to stay in business, and you need the right computer, you need the right technology, you need the right number of rooms, you need the right number of nurses. The nurses need to be trained. It's just the most efficient way to get it done right. It's just anything you do in life, if you don't have the right equipment, you don't do it as well. And Tanner's a big, strong company. They do it right. I look forward to seeing you at Tanner Primary Care Roanoke.